And what are some of the misconceptions about nose surgery?
Well, sometimes, first of all, there's a very strong tendency to take off that splint and think, aha, that's the new nose, or peel off that dressing for the facelift and go, aha, that's a facelift. And while you get some idea of where things are when those 3 or 4 days later, one thing to keep in mind is it truly can take months and months to see the final result. Well, what does that mean? That means that there may be some bumps or dents or irregularities or unevenness during the healing process that may actually go away on their own as the tissues continue to heal together. I think that's the most important thing is sometimes people get confused that this is the final result. And the hardest thing about the nose is, of course, you're looking at it all the time, every day, so people are studying it in detail. Particularly after they've had surgery, and it's right in the center of your face, and so sometimes they have to understand that the healing process going on inside the tissues is much slower than what they see. So even though the skin looks fine and it doesn't seem to be moving much, the nose hasn't finished healing at all.
What are some of the alternative choices for chickens?
Well, with nose surgery, there aren't really a lot of the non-surgical alternatives related to reshaping your nose. Of course, nothing's really going to reshape your nose other than surgery. If you're primarily having surgery for a breathing problem, of course, there are medical treatments. There are decongestants, there are sprays, antibiotics sometimes are appropriate, and normal what we consider nasal care, breathing in some hot steam, making sure you're well hydrated. All these things actually add up, and they can be very important to achieving good nasal respiration.
What are some of the common issues that should be brought up to a person's doctor in regards to nose surgery?
With nose surgery, as I said, there are quite a bit of variations in technique. So when you talk to your doctor, you first, of course, want to find out whether they're doing an open or a closed rhinoplasty, making an incision along the bottom of the nose. As I said, I myself consider that not very frequently a valuable technique and causing a scar that I find visible. I believe it interferes with the circulation in the tip to the nose. I think it may cause more swelling, and I think it actually makes it harder to visualize the exact result that I'm trying to achieve. You want to find out whether the doctor feels that your nostrils are the right length, whether he feels that he needs to make some incisions to thin down the base. You want to find out whether he feels like he's going to fracture your nose or follow your nose. Does he think that you need some kind of graft or some cartilage from somewhere else to help build up the bridge? If he's getting cartilage from somewhere else, can he get it from the inside of your nose, or does he feel that it's better to take it from, again, somewhere else in your body? Does the doctor put in packing after surgery? If the doctor does put in packing, then you will be completely blocked up, meaning unable to breathe any air through your nose for however many days that's in, and I can tell you that's a miserable experience. I haven't put packing in my patients' noses in 15 years, and while they do put up with maybe some bleeding for a day or two, I think they're much, much more comfortable in that regard. And also, will the doctor be addressing any breathing or sinus problems that you have? Do you have chronic headaches that need to be taken care of? Is the doctor, is he dismissing them because he doesn't think they should be taken care of, or because he just doesn't have the skills or desire to take care of them at that time? Also, again, do you have insurance that could be covering part of your nose procedure, but this particular doctor is saying that it's not covered by your insurance because he or she doesn't want to process your insurance for it, or because it really isn't? So those are things you might think about when you're talking to your doctor.
Dr. B, what are some of the general costs that are involved in nose surgery?
Well, with all surgical procedures, there's some division of these costs. There is the surgeon's fee, there's the operating room fee, there may be the fees for your medicines. If the tissue gets sent for pathology, there may be a laboratory fee. And then there may be some adjunctive fees related to, of course, anesthesia. There's the anesthesia fee. And then besides, if you are paying some cash or something extra for a cosmetic procedure, you may also have co-payments related to your insurance. So you want to do the best you can to get a very global idea of what all the costs are going to be involved in your procedure.
And what are some of the approximate fees in Los Angeles?
Well, cosmetic surgery, rhinoplasty procedures, can cost anywhere from $2,500 or $3,500 to $7,500 or $8,500, depending on, to some extent, what the surgery is worth to the person who's having it, to have it done by some particular doctor or not. Often, patients are paying for bells and whistles and things that are patient counselors or fancy offices or expensive marketing are simply prices that are being tagged on to your charges, rather than you finding the doctor who can really just effectively treat your problem and give you a fair price. So those are all components of what you're paying, and you might want to be a sharp, smart shopper and not entirely be taken in by hype.